the honor of serving as the president and CEO of Foodlink, and it is my great honor to welcome Senator Schumer here today. It's a privilege to be the representative of 130 plus team members here at Foodlink and hundreds of nonprofit community partners who work year-round to ensure food access for our neighbors across the Rochester and Finger Lakes region. It's especially meaningful for you to be here at the beginning of our holiday season here on Thanksgiving week. We will spend about $2 million on holiday food this season. We'll distribute about 40,000 boxes of New York State grown produce, of cheese, milk, and eggs that were produced by New York State dairy farmers. We're grateful to be able to do that this holiday season. But we also know emergency food distribution does not fill the gap. It's why we have invested so much in our curbside market for the last decade. It's why we debuted the first mobile WIC unit in the nation here. We know we need innovative retail options, and most importantly, we need critical government programs like SNAP and WIC, which is what we're here to talk about today.
But here we are in the Thanksgiving season, and as many families here in Rochester and Finger Lakes area prepare, so many people in upstate New York prepare dinners for the holiday season, some of our most vulnerable mothers are nervous that they could struggle to keep food on the table after the holiday season because a vital nutrition program right now is in limbo. It's called the Special Nutrition Program for Women, Infants, and Children. You probably heard of it. It's called WIC. That's the abbreviation. It's a unique program. It provides food for 429,000 kids, babies, and families across New York. Over 21,000 people here in the Rochester and Finger Lakes area. This funding is going to run out in January if we don't get something done. And so I'm here to say to the people here at Foodlink, to the 21,000 families with kids in the Rochester, Finger Lakes area, and to all of New York and America, I'm going to do everything I can as majority leader to see that this food for women, infants, and children continues to get funded. It's so important because all the science, all the studies show us that when kids are hungry, they can't learn well at school, they have health problems. Food is essential. And in 21st century America, we should not have kids go hungry. And I think.
So I joined WIC in 2015 when I was pregnant with Amelia, and it continues to be a lifeline, like the Senator said, for us today, our family. It's not just help with groceries, though, and everyone knows that. It's like so many other families, the Supplemental Nutrition Program for Women, Infants, and Children gives us referrals to other healthcare providers.
Right.
It provided breastfeed support from mothers participating as peer counselors themselves. And it gave us well-tailored monthly food packages that were individually focused on what's most important for each child at each stage of development, and that's really important. Well, WIC has been keeping moms and kids healthy for nearly 50 years. We're going to celebrate 50 years in the spring. And without the additional federal dollars, WIC won't even have enough funding to cover anyone who's eligible to join in the new year. All mothers and caregivers of young children deserve the certainty of knowing that WIC will be a continued support for the entirety of fiscal year 2024. And it's not just because folks like myself have been working really hard to increase recent WIC enrollment and participation and retention rates, but because its success is backed by solid science. And right now is no time for us as a nation to give up on the principle that food is medicine. I can't imagine being forced to tell my kids no when they ask me for mangoes and broccolis, and if Congress steps up, I won't have to. And millions of other families will have that peace of mind too. So, WIC's always been there for us, and Congress needs to get it together and be there for WIC as well.
Well, thank you very much, Ricky.